Hello, and welcome to the National MS Society's special celebration event, 5 Years of Breakthroughs. My name is Rick McDermott, and I first began volunteering for the National MS Society almost 30 years ago when two of my sisters started exhibiting symptoms of progressive MS. Today, I serve as a national director and a Greater Carolinas trustee. Thank you for joining us here today for this exciting moment, 5 years in the making. Today, we get to celebrate the historic achievements of the Society's largest and most comprehensive fundraising campaign in history, Breakthrough MS. It's because of you that we're here today. Your dedication and generosity have made breakthroughs possible for people with MS. Now, I'm pleased to welcome my co-host for today, National MS Society President and CEO, Cyndi Zagieboylo. Cyndi?
Thanks, Rick. It's great to be with you on the virtual stage. And thank you all for joining us. I'm excited to celebrate all that we've achieved these past 5 years. So often we just keep moving forward to the next breakthrough people need. It's rare that we spend time looking back just to celebrate. We have so much to do and we want to focus forward. At the same time, just for a minute, look how much we've accomplished. Together, we have changed the lives of people affected by MS. And thanks to you, your dedicated giving, your tireless fundraising, your volunteering, your spreading the word, sharing your story, inviting other people into the MS movement, it all adds up. Today is about recognizing you and all the ways you have made life better for people with MS. Breakthrough MS was conceived to mark the beginning of the end of MS. It is a story of remarkable aspiration, dedication, resilience, and belief that when we marshal the strength of our movement, our energy, our voices, and our resources, anything is possible. When we embarked on this campaign 5 years ago, it was time to seize the breakthroughs just beyond our grasp. Ones that would change all aspects of life for people affected by MS. We knew the Society's comprehensive efforts to empower people, amplified voices, and drive research discoveries would need attention and resources to change lives in the ways people need. What we didn't know is a once-in-a-lifetime pandemic would try its best to throw us off course. But despite the significant challenges we faced, we did not falter. We remained focused on our mission. We will cure MS while empowering people affected by MS to live their best lives. $878 million has been raised so far from 3.2 million supporters and 5.7 million gifts, ranging from $35 to $35 million. We've achieved as much progress in these last 5 years as in the 70 years that preceded it. With just over a month left to complete this campaign, we are poised to reach a record-breaking $900 million. We gratefully and enthusiastically share key achievements of this historic campaign with you today to inspire us all to keep pushing toward this tremendous milestone. Now, sit back and get ready to be inspired as we travel through 5 years of breakthroughs made possible by you.
Thank you, Cyndi. We all know that we're an eager and ambitious bunch. And as you mentioned earlier, it's not often that we take the time to look back and celebrate all that we've achieved. But it's so important to remind ourselves how far we've come and what's possible when we work together. So let's start from the beginning. In 2017, when we launched Breakthrough MS, we really came out of the gate strong with some monumental breakthroughs for our movement.
You're right, Rick. 2017 was the year we launched our MS Navigator program. providing all people affected by MS, regardless of where they live, access to a highly professional and supportive partner, an MS navigator, to work through problems and remove obstacles in the way of living well. This is a foundational and essential service. So we made sure the pandemic did not stop us. It barely slowed us down, as we had prepared for MS navigators to work from home. Since 2017, nearly 250,000 people have received support, guidance, and partnership from MS navigators. Professionals who work one-on-one over days, weeks, and months to reach lasting solutions to the problems and concerns facing people affected by MS. Let's take a moment to hear one woman's MS navigator story. Susan.
Hello, my name is Susan, and I was diagnosed with MS in 1993. I'd like to take this opportunity to share my gratitude for the MS Navigator team who helped change my life, and to all the MS Society supporters who made this valuable service available to me. In 2019, when my disability from MS caused the need to relocate to my parents' home in Massachusetts, I was overwhelmed. Lindsay, as my MS navigator, you understood my situation and directed me to resources, helped me through applying for reimbursements of moving expenses, and finding Katrina, my case manager. Katrina, you helped me see some of the resources available in Massachusetts and how to start applying for things such as a handicap parking placard. And you found Jeanette, the case manager, who helped to change my life. Jeanette, you came to my home and worked with me to imagine a list of goals that became a beacon during many difficult months. You communicated so much needed information, which I was able to use in my transition. You met me at the Social Security office for my interview, which truly made a difference for me to communicate my situation with them. You walked me through the process of searching for income level affordable housing, showing me the way. And it worked. I won a lottery. I was awarded an affordable apartment fitted with ADA, and it's perfect for me. I am now living a retired life that supports my disability. This achievement was made possible with the help of my shining stars of the MS Society. I thank you.
Wow, I love hearing Susan's story because it really shows the power of MS Navigator. This isn't a one-time support transaction. It's not a Band-Aid. This is a service that supports people every step of the way through the challenges that they are facing to improve their lives for the long term.
It is a dream come true, Rick. I'm so proud of us for making this dream a reality. You may not know this, but over 35 years ago, I started as an old-time MS navigator, just picking up the phone and mailing out information and doing what we could. And we've come a long way since then, and the MS navigator experience keeps evolving. You know, we won't settle for good enough at the MS Society. We are always looking for continuous improvement. Right now, we're working to expand access to MS Navigator support using text messaging, for example. And we are getting more proactive, anticipating problems so we can show up in people's lives well before they have a crisis. We need to be a go-to organization for everyone with MS. People have to feel safe and welcome when they connect with us. In order to be trusted, we need to be trustworthy. So we focus on being culturally relevant, eliminating the barriers to access, making sure people know that we are here for everyone, and you can find your place in the MS movement regardless of your age, your race, your ethnicity, your disability.
Absolutely. The work we are doing around diversity, equity, and inclusion is so important. It's critical that everyone be able to see themselves and feel belonging and at home in the MS movement. MS Navigator was not the only breakthrough in 2017. It was also the year that the very first therapy for progressive MS was approved by the FDA, an achievement made possible through years of foundational research on B cells supported by us, the National MS Society.
This was a big deal, Rick. Over the years, as the number of approved treatments for relapsing remitting MS continued to grow, it was hard on people diagnosed with primary or secondary progressive MS. I remember some people saying, "Are you my MS Society too?" And while I could promise that we see you, we're with you, and it's not for lack of trying, it's just that we haven't found anything that works yet. The optimism was difficult to justify, and many people felt forgotten. So when Ocrevus came to market in 2017, it was a game changer. Real evidence that our investments lead to breakthroughs. And while Ocrevus was an important step, it's not the only solution. There is an urgent need for more and better progressive MS treatments. Well, Rick, are we still talking about 2017? It was the year the International Progressive MS Alliance launched 3 large-scale collaborative networks. The Alliance, with the Society as the lead agency of MS organizations from now 19 countries, brought together scientists from around the world to drive innovation and speed progress for more progressive MS treatments. These networks marked a big milestone, bringing the brightest minds together to tackle progressive MS head on.
I know that these networks launched a novel approach to the problem. It had never been done before. And as a society fundraiser, I'm excited by the economics of it. Through worldwide collaboration, we can focus great scientists on our biggest MS challenges, and with so many countries contributing financially, we multiply our investment. Let's take a look at what this progress has meant for someone living with progressive MS. Kevin.
My name is Kevin, and I was diagnosed with MS in 2002. I didn't know really what MS meant, what it was. It didn't sound good, but it was definitely overwhelming to get that news. The progression of MS, that's the really tough part about this, is progression is unknown what's going to happen. It was definitely overwhelming to think, oh yeah, this is how it is, and it's at this point not going to go away. It's going to actually keep progressing. Eventually, my right leg not functioning, as well as my left arm. So now I've had both legs and my left arm affected by the progression of MS. It's definitely an amazing thing when your doctor says, "Hey, here's a medication that will help with what you're dealing with," specifically. No matter what the disease is, but specifically in my experience, the fact that there was finally one medication that was specific for this progressive type of MS, it was actually really encouraging. When I heard about the International Progressive MS Alliance, I was very encouraged because the International Progressive MS Alliance is a network of multiple sclerosis societies from many countries around the globe, in combination with researchers and doctors, stakeholders in the pharmaceutical industry, foundations, donors, and people affected by MS. They're all coming together to work on this huge, massive problem that is progressive MS. It's a very specific problem, but the fact that the entire globe was coming together really spoke to me, because I'm a firm believer in collaboration. And this huge problem of progressive MS is going to require huge global effort to figure it out. As things get faster and faster, we're going to see more and more things be developed. And so it's it's exciting to say, in the past 5 years, things have been moving very quickly and very, in a good way. Cure of MS to me would mean I could walk again. A cure for MS to me would mean I could shower by myself again. A cure for me would look like I could have a lot of my life back. MS takes a lot from us, and to me, how I would define a cure would be something or ways to get my life back. So if supporters of the MS Society, I want to say thank you. I want to share my gratitude with you. I know supporting the MS Society is a strong belief that we are making progress. The MS Society really does hold a hope out there that we're going to find a cause and a cure for MS. I'm so excited that you're going to be a part of that.
Thank you, Kevin. I think you're out there today watching us. We appreciate you describing some of the harsh realities of progressive MS and also your definition of a cure. That's exactly what we're working towards. Kevin is such a passionate spokesperson.
I agree, Rick. And what you can't see from this video is the amazing talent Kevin has in bringing people together. You saw some of the pictures, you could maybe get a sense of that. He knows that first and foremost, the most important resource we have is each other. And I think he's just amazing.
Yeah. Let's keep traveling through our 5 years and take a look at 2018. Which included celebrating the first approved therapy for children with MS. And to think there was a time when it was believed that kids don't get MS.
That was a long time ago now, Rick. For more than a decade, we've been increasing awareness about pediatric MS and improving diagnosis and care of children and teens with this disease. The approval of the first treatment for pediatric MS in 2018 was a huge milestone. We also recognize that families that have a kid with MS need specific support to navigate all the challenges of MS and its effects on learning in school and on everything that comes with adolescence and beyond. This is why, in 2018, we expanded awareness and increased support efforts around pediatric MS to ensure kids and families have what they need to live their best lives.
Hey, Cyndi, there is one teen in particular, Hannah, who has been a leading voice in helping us get the word out that kids get MS too. Let's take a look at her story.
I'm Hannah. I was diagnosed with MS in February of 2018 when I was 15 years old. When I first noticed something was wrong, I woke up with numbness from my waist to my toes. I've never experienced any kind of health issues like that before. I kind of immediately assumed that it was a pinched nerve, so I thought it was going to be fixed, but after it kept on persisting, I decided that if something was wrong, and I was honestly terrified because I didn't know what I was experiencing at the moment. When I first learned that I had MS, I looked into it at first because I wanted to know more about it. I had no idea as to what it was. And when I Googled it, I saw that it was mainly diagnosed in ages 20 plus. So that caught me off guard extremely because I was only 15 at the time. And I didn't understand how it was possible considering I was such a young person. When I noticed that I couldn't find any like other teenagers or kids with MS, I kind of felt like, I wouldn't say an outcast, but I did feel alone in a sense considering the majority were not in the same boat as me. I didn't know exactly what to do other than reach out to other people through social media. I started posting about checkups on my Instagram account. I posted my diagnosis story on my YouTube channel, as well as the medicine that I use. I was showing that, and I wanted to show like the more like real side of MS because not many people know what it's like to have it. When I first connected with the National MS Society, they reached out to me asking me if I wanted to share my story through a short video with a few other teenagers that were around the same age, one even younger, maybe about 7 years old, also diagnosed with MS, and we were trying to highlight the fact that kids also get MS, and from there I was always in contact with the National Multiple Sclerosis Society to help advocate for kids. I think all of the awareness for kids with MS is really helpful to the kids themselves, and even their families as well, and just the general population that knows of MS that are looking into it, considering when you first look into MS, it's kind of sought out that no kids get it, at least when you Google it, that's what it seems like. And considering we have so much advocacy for these teenagers and kids and young adults, it's helpful because they know that there's other people around the same age as them that are going through the same issues and they're not alone. I do feel optimistic about my life, considering I've gone almost 4 years now with MS. I feel as though I can honestly get through anything, because hearing you have a diagnosis of an autoimmune disease, it's kind of hard to hear at first, but once you accept it and get past it, you feel as though you can take on anything, essentially.
She's pretty incredible. That the one-person show raising awareness. I love her story. When Hannah was first diagnosed, she recognized the need for more community support for kids with MS and their families. So she didn't sit around. She took action. She created an online community and connections. And I'll say it again, the most powerful resource we have is each other. And today, pediatric MS is getting diagnosed more quickly thanks to our network of pediatric MS specialists. And there are now several treatment choices for children and teens. As you can see from Hannah's story, the outlook is positive with early treatment, high quality care, and connection with the National MS Society. We are here for kids and their parents.
Yes. And I'm so glad, Cyndi, that you mentioned high quality healthcare, because as we all know, that is a critical component to living well. And in 2019, we made huge strides in this area.
Yeah, that's true, Rick. Providing people with access to high quality MS healthcare has been a focus for years. In fact, our clinical fellowship and training opportunities have helped launch the careers of MS healthcare professionals who take care of people with MS. Over the course of Breakthrough MS, we added 85 MS specialists to the list, thanks to our clinical fellowship program. Now, these 86 special professionals will care for over 100,000 people with MS during their careers. Every healthcare professional we invest in leads to many people with MS receiving up-to-date specialized care. Now, I don't have the data on this, but from what I hear, the first doctor telling someone you have MS often sets people on a journey for a neurologist they can relate to, who lives near them, a caring MS specialist who gets them.
That is so right, Cyndi. And that's why in 2019, the Society launched its Find Doctors and Resources tool on our website, equipping both people with MS and our MS navigators with a comprehensive online resource for identifying qualified MS care providers in communities across the country. And to further extend access to MS specialists, especially in rural areas, we launched the ECHO MS program, which connects MS specialists with healthcare providers across the country through a mentorship model. A specialist works through a general practitioner to deliver specialized care to people in their own communities. This multiplies the reach of our MS specialists.
Another example, we'll do whatever it takes. This is super important, Rick, because not everyone with MS lives in a place where specialty care is available. For many people, finding specialty care means traveling hours by car or even by plane to get what they need. This is a huge barrier to living well with this disease.
Let's take a moment to hear from a society-trained neurologist, Dr. Roberto Cruz, and how he's bringing high-quality MS care to his rural community of McAllen, Texas.
My name is Roberto Alejandro Cruz. I'm a neurologist that specializes in multiple sclerosis, and I'm currently working in McAllen, Texas. I grew up in Tampico, Mexico, which is very close to the South Texas border. Back in Mexico, my dad is a physician since I was a very young age. He actually inspired me to become a physician as when I was seeing the impact that a physician has in their community. While I was a medical student in Houston, Texas, the opportunity was presented to me to start doing research in neuro-ophthalmology. At the beginning, I was really not sure if that's what I wanted to do, but it was quite a surprise that I started to see that most of the patients that I was dealing with, they were patients that had been diagnosed with multiple sclerosis, and I just fell in love on how, as an MS doctor, they can do so much of an impact in someone's life. You are diagnosing someone when they're at the peak of their life, and all of a sudden they're faced with this uncertainty that you have this chronic disease. And for me, it was very admirable how the physician, the MS specialist, kind of handhold this 20-year-old, sometimes 18-year-old patient, and they basically kind of go on with them and they become a big part of their life, right? And the fact that we can actually, or they were able to make a difference and to impact their life, for me, that was just a no-brainer, and that's when I decided that I wanted to do neurology because I wanted to become an MS specialist. When I opened my MS clinic in McAllen, Texas, which is in the Rio Grande Valley in South Texas, which is considered a medical underserved area, and especially in something like multiple sclerosis, I was amazed by the response of the community. It was very heartwarming how these patients were very moved for having now someone local that understands a little bit more or better of what their disease is, or maybe to bring some options that for them there was not available before. To all the National MS Society supporters, I just want to start saying thank you. Thank you, because what you do for that society impacts a big community. It impacts the life of so many people, not only the patients, but some people like me, like myself, which I started with a dream of becoming a physician, which then kind of evolved to be a dream of becoming an MS provider for my own community that didn't have one. And now we're going to be able to help close that gap. It has been meaning a lot, and I couldn't have done this without the MS Society, and I couldn't have done this without your support. So thank you.
That is what we're talking about, Rick. What a great win-win. Dr. Cruz wants to take care of people throughout their MS journey, and he sets up an MS specialty clinic right where people need him. And he's thanking us for making his dreams come true. Can you imagine what he means to his patients? Who wouldn't want a doctor who cares that much? I hope you can feel, all of you out there, the power of the MS movement. This is a great example of the ripple effect your support has on people's lives, people affected by MS and the MS specialists who provide care. And together, we can produce more stories like Dr. Cruz's, MS specialists devoted to people with in an underserved community, a targeted approach to reduce health disparities by expanding the number of providers who are inspired to serve where people with MS need them.
Now, let's talk about 2020, a year like no other in our history. But let's talk about how your support helped people affected by MS stay resilient, connected, and supported during a time of so much uncertainty.
There's no doubt about it, Rick. This was our most challenging year on record. With the pandemic, we had to act quickly to meet the needs of people with MS, and we did. People needed answers. We cut through the noise and got to the best, most accurate information about COVID and MS. We gathered experts so that we could describe a path forward through the pandemic, addressing those all-important MS-specific questions about vaccination and drug therapies. We loaded our website with vetted, comprehensive MS information and held true to our promise to be the go-to source for what you need when you need it. We pulled out all the stops and took advantage of new technology to launch virtual education programs and support groups that kept people informed and connected. And a pandemic wasn't the only thing people in the United States were thinking about last year. 2020 was a year of deep reflection on the racism and systemic injustices that have affected every aspect of life for communities of color for hundreds of years. The National MS Society exists because there are people who have MS, all kinds of people, and we envision a world free of MS. But we will never achieve our mission as long as there are people in the MS community who face discrimination, exclusion, and even violence. That's why we must address the disparities underrepresented groups face when it comes to living their best lives now while we pursue MS cures. In 2020, we had to cancel our African American MS conferences. We had held these important opportunities for Black people affected by MS to come together, to learn, and support each other across the country for over a decade. It was going to be our 19th year for the North Carolina conference, and we were expanding. It was a terrible disappointment. We didn't want to let people down. So we had to go virtual. And thanks to the rush to innovation of virtual conference tools, we pulled off an amazing Black MS Experience Summit, put together in just a few months. We just had our second summit in September of this past year, and it was also a big hit. While we were hoping to engage people who attended our in-person conferences, make sure they had a place to go, we were delighted that the virtual experience brought new people to us. More than 25% of the 800 plus participants were new to the society. And that success was repeated this year. It's clear that we have more people to reach. We also expanded Hispanic Latinx programming with monthly Ask an MS Expert webinars provided in Spanish and Spanish-speaking MS specialists. And coming up this year, we will hold a Hispanic Latinx Experience Summit. With greater awareness, we have new opportunities to expand our reach to underserved communities, to take down the barriers to high-quality healthcare, and deepen our understanding of disparities through research and diverse clinical trials. And we can all contribute by inviting people in, by learning with an open heart about each other's lived experiences, and understanding how we can move forward together, ensuring everyone sees themselves and feels belonging in the MS movement. We are a movement by and for all people affected by MS. Despite all we have done and achieved, we have much more to do to walk this talk.
Cyndi, let's take a look at Anne Marie's journey to find her place in the MS movement.
My name is Anne Marie, and I was diagnosed with MS on New Year's Eve 2002. When I was first diagnosed with MS, what started as a normal day quickly turned into something else. While I was at work, I was having difficulties holding and grasping a pen, and really didn't think much of it. Decided, I'm just gonna go home and make myself a cup of tea and everything's gonna be okay. But it wasn't. I woke up that next morning and I had total numbness from the waist down, and I couldn't use my hands, I couldn't hold a cup, couldn't brush my teeth, couldn't comb my hair. But more importantly, I was scared to death. MS affects you at the prime of your life. I had just started a new career after years of education. I'm in the workforce now, and all of that changed. When I was first diagnosed, there weren't that many options, I guess you can say, for people of color. There wasn't that much in terms of PR. Often if I picked up an article that talked about MS, it wasn't featuring a Black person. Very far and few in between did I ever see anybody of color being talked about regarding their journey. So fast forward to today, 10 years later, now I have a Black Experience Summit that was nationwide. There was people from even outside of the United States that partaked in that. With one woman actually saying, I wish we had something like this where I'm at. That's the kind of reach we need. That's why we do what we do. What we do matters. I would have never thought that writing a letter to an organization just asking, where are people that look like me, would turn in today as someone who's been on Capitol Hill and spoke right next to House Majority Leader Schumer. Who would have thought I would be publishing newspaper articles from the New York Times to WebMD? Who would have thought that that girl from Brooklyn, who's poor, would be able to reach so many? Keep doing what you're doing, because believe me, you're helping many. Thank you.
What a role model. She is an inspiration.
She is really something. Absolutely.
Yeah. What started as a valid and critical observation of the absence of presence and engagement of people that Anne-Marie could relate to turned into more diversity, greater engagement of Black people, and a transformation. Anne-Marie is leading the way. She describes her feelings of belonging, of empowerment, and of sharing her truth on Capitol Hill and the New York Times. She's still going strong, Rick, and more people are joining the society to do what they can.
She is definitely the definition of walking the talk, for sure. Well, Cyndi, in our journey through time, we've now arrived at 2021. I know the achievements we're going to highlight for this year really signal where we're headed next.
Yes, that's true, Rick. For instance, just a couple of weeks ago, we released a study revealing the financial burden of MS with an annual cost of over $65,000 per person and a total cost to the U.S. economy of more than $85.4 billion per year. This study highlights the far-reaching and considerable cost of this disease and equips MS activists with new evidence to influence policymakers and industry leaders in helping lower the cost of MS care and treatment.
Right. And addressing cost becomes even more urgent as MS care and treatment breakthroughs continue to accelerate. For what good are treatments if people can't afford to access them? That leads us to our next big achievement in 2021, our work to develop and gain global consensus on the most promising pathways to cures.
After 75 years of progress, with these last 5 years being our most prolific, we are now positioned to write the last chapter of MS. We will do this through our biggest, boldest, and most collaborative effort yet to find cures for multiple sclerosis.
To share more about this exciting initiative, I'm pleased to introduce the Society's Executive Vice President of Research, Dr. Bruce Bebo. Bruce?
Thank you, Rick and Cyndi, and thanks to all of you joining today. It's been such a pleasure to listen and to celebrate all that you've made possible for people affected by MS over these past 5 years. And Cyndi's right. All this progress has brought us to a profound new moment. And today, we know enough about MS that we're able to pinpoint the remaining questions standing in the way of cures. And I can't emphasize enough the amount of time, effort, funding, all of it that it's taken to get to this point, and just how crucial a moment it is for the world to come together around cures. And while the National MS Society has been a global leader in MS research for decades, these past 5 years have been particularly important for us in preparing for this moment. As you heard earlier, we played a significant leadership role in the International Progressive MS Alliance. And this experience over the past 5 years has allowed us to forge global collaborations and innovation and to influence the funding of others unlike at any other time in our history. And this collaborative approach to progressive MS is working. It's accelerating promising leads to life-changing treatments. And now, it's time to forge global collaboration around what we all desire so deeply, and that's cures for MS. And not just cure for some, cures for every single person, whether that's stopping MS in its tracks, restoring function that's been lost, or ending MS forever by preventing it for future generations. And after spending this past year gaining a global consensus on these pathways, the Society will publish the Pathways to Cures roadmap soon, and we will advance key objectives with targeted investments that will inspire the world to follow our lead. With a collective focus, we will stop MS. And this pathway, this is about people knowing they will never see a new lesion on an MRI. This is about eliminating the possibility that things will get worse and eliminating the fear of what might come next. And we will accomplish this through early diagnosis and by developing effective disease-modifying therapies and/or lifestyle interventions that are personalized for each individual. And tremendous progress has been made in the understanding of the immune pathways that lead to MS, and this knowledge has led to really a revolution in the treatment of MS. And out of the 20 disease-modifying therapies that are currently available, 9 were approved over the last 5 years. That's almost half. And each of these approvals is a milestone that measures our progress toward cures. And the pipeline of treatments being tested for all forms of MS is rich. There are hundreds of active clinical trials testing novel approaches for treating MS. And that includes not just pharmaceutical approaches, but cell-based approaches, rehabilitation, wellness, and lifestyle strategies as well. One very promising target for the next generation of disease-modifying therapy for MS is called Bruton's tyrosine kinase, or BTK for short. And BTK is a signaling molecule that is expressed in B cells. We heard about B cells earlier. And these cells play a critical role in causing damage to the nervous system in MS. And we've seen very promising data from intermediate phase clinical trials of BTK inhibitors and recent reports of numerous large phase 3 programs that are underway for both relapsing and progressive forms of MS. In addition to being expressed by B cells, BTK also seems to be an important regulator of cells called microglia that are thought to be involved in the compartmentalized inflammation that drives progressive MS. So we might be able to give MS a 1-2 punch with agents that target this pathway. I'm also excited about recent progress in the development of biomarkers and advances in MRI and other technologies that will contribute to earlier diagnosis and a better ability to measure response to therapy, which would help advance our goals of the individualized treatment and early diagnosis with improved outcomes for people with MS. This progress and a lot more that we don't have time to talk about today is an indication that we're getting closer to achieving our objective of stopping MS. With a collective focus, we will restore lost function by accelerating development of myelin repair treatments and rehabilitation solutions along with wellness and lifestyle changes. This pathway is about getting people back what MS has taken away. To be able to play with your children, to work a job that you love, to go for a walk. This is about not missing out. And it has become apparent over the last few years that the nervous system has an untapped potential to repair myelin, and strategies to unleash this potential in MS are evolving. This includes a growing list of both pharmaceutical and cell-based approaches. Some of the pharmaceutical approaches are being tested in human clinical trials. Now, unfortunately, an advanced myelin repair program, an agent that some of you might remember called opicinumab or anti-lingo, they recently reported negative results. And while this is disappointing, of course, but because this was a rigorous and well-performed clinical trial, we will learn a lot from this failure, and it will inform studies. And there are many other approaches to repairing myelin in the pipeline that give me hope that it's not going to be too much longer before we see a success here. And cell-based approaches also hold promise for promoting myelin repair. And important to share that rather than directly repairing myelin, what we think stem cells are doing or other kinds of neural progenitor cells, what we think they're doing is to produce a cocktail of factors that after they're transplanted, create an environment that favors repair. And laboratory studies have identified a number of viable approaches for cell-based therapies, and there are ongoing human clinical trials that we'll be reporting out shortly. And I want to talk about plasticity for just a second. So plasticity is the ability of the nervous system to rewire its connections. And this is a strategy that the central nervous system uses to take over function from areas that have been damaged. And the ability of the nervous system to compensate for damage declines with age. So that's the bad news. But we are learning how to promote plasticity in the adult nervous system, and that's the good news. Recent data have elucidated the disease-modifying effects of exercise and have documented changes in the brain using MRI imaging. In addition, computer-assisted cognitive rehabilitation has been shown to improve attention and working memory, and is also accompanied by changes, real changes in brain activation and connectivity between brain regions. The neurology profession is really starting to embrace rehabilitation, wellness, lifestyle interventions, recently referring to them as medicine. And work is ongoing to determine which interventions and what doses of these interventions will achieve optimal recovery of function for individuals with MS. And with a collective focus, we will end MS forever by preventing new cases. And this pathway, this is about knowing that your children and or your grandchildren will ever get MS, that this disease is in the history books. And this will be accomplished by reducing exposure to risk factors in the general population, or by identifying individuals at high risk for developing MS and deploying interventions that delay or maybe even prevent the onset of clinical disease. Over the last few years, we have come to appreciate that MS may be a preventable disease. Significant progress has been made in identifying factors that increase the risk of developing MS, including things like low serum levels of vitamin D, adolescent obesity, tobacco smoking, and symptomatic Epstein-Barr viral infection, or otherwise known as mononucleosis. And in addition, more than 230 common genetic variants are known to contribute to MS risk. So a better understanding of risk factors, genetics, gene-environment interactions are all revealing insights that may lead to development of prevention strategies that could reduce the risk for MS in the general population, things like a vaccination for EBV, for example. Another leading concept is that we may be able to identify people at high risk for developing MS and or diagnose MS in its very early stages and intervene in ways that may significantly delay or even prevent the clinical appearance of disease. Progress is being made in identifying and understanding the prodromal phase of MS. The prodrome is defined as the time period that precedes the development of any disease-specific symptoms. And there's a growing appreciation that MS has a prodromal period. and that we may be able to identify people who are at high risk for developing MS and treat the disease prior to development of MS symptoms. Recent publications have reported a pattern of healthcare use in people in the years prior to their MS diagnosis. And some of the common prodromal symptoms include pain and sleep disorders and fatigue. And other reports have implicated the levels of a biomarker that indicate damage to the central nervous system called neurofilament light chain, and that these levels of this neurofilament light chain are elevated during the prodromal phase of MS and could potentially be used to identify people at high risk for developing disease. So I'm optimistic that we may be able to use a combination of observations such as family history, genetic profile, healthcare utilization, biomarkers to identify people at high risk for MS and initiate a prevention strategy in the near future. So as an important stakeholder in this work, you're going to be hearing a lot more about Pathways to Cures in the months and years ahead. But today, I want to recognize and thank you. And thank you for helping us get to this pivotal moment in time. And through Pathways to Cures, we can be the generation that ends this disease and changes life for millions affected by MS. The next chapter in our journey is ours to write. So thank you.
Thanks, Bruce, for that very exciting and inspiring update. That's really exciting, all of the developments. We've come so far thanks to all of you, and there's so much to look forward to, so much hope, so much optimism, so much more progress. To cap off our celebration today, let's watch Antonia's story, a young woman diagnosed with MS in 2017, the same year we launched the Breakthrough MS campaign.
My name is Antonia, and I was diagnosed with MS in December of 2017. When I was first diagnosed, I had no idea what MS even really was. So it was a little bit more shocking than normal, I would think, because I really didn't know. The connection to the MS Society and then ultimately the Emerging Leaders Board, as I will always say, really changed everything for me. It's just such a powerful group of people that are trying to change MS and trying to put a different face on it. Because there are a lot of young professionals that get this disease. There are a lot of people affected by this disease. And you feel at home. So how I feel today compared to 2017, I'm a completely different person. I think a lot has to do with the support system I found in the National MS Society and being surrounded by the ELB, doing all of these fundraisers, seeing all these people that come out and support and try to understand this disease and spreading the word about this disease it just has helped me drastically feel better about having it, first of all. We all have so much more hope now, even than 2017, even 4 years ago. I mean, there's so much more research now. There's so many more DMTs, so many more people. I just feel like this disease is like, people understand it now. With the National MS Society, you know, all 25 of us that are on the ELB, we try to push this on everyone we know. Let's talk about it. So I thank you so much, and I really, really, really appreciate everything everyone does on a day-to-day basis. And even if they just come out to support, that is enough. If they just show up to one event, that is definitely enough to make us feel supported and hopeful for the future.
As you can see, a diagnosis of MS today, along with effective treatment, high quality care, and connection to the National MS Society, can bring hope, optimism, and empowerment like we've never seen before. Leading up to this event, you might remember that we asked you about your outlook on the future. And here's what you had to say.
Through Breakthrough MS, you have turned ambition into action, agility into innovation, and most importantly, progress into breakthroughs. Life with MS is better because of you. We are so grateful for all that you've done and will continue to do to help us reach our vision of a world free of MS. Thank you from the bottom of our hearts.
Thank you, Cyndi. And thank you all for joining us here today. I hope you feel inspired and energized, like I do, to keep contributing to this life-changing work. I'll see you out there. Take care, everyone.